For our treatment providers who majority of their funding and majority of their revenue that they bring in to deliver services out comes from the state or comes from a stream that's funded by the state. So when they passed the budget and the governor vetoed it, it essentially stopped all spending on all services in Illinois, whether it's mental health, addictions, or something else.
The psychiatric leadership grants are essential to community mental health centers being able to provide psychiatry services.
And we're seeing things like psychiatrists that aren't no longer in the system.
Without those payments from the state coming in, agencies will eventually get to a point where they are not able to make payroll for their staff.
The question of how long can providers go before they close their doors, certainly I think that while that's on an individual basis, we're starting to see many that are really hanging by a thread. And I would say by the next month or two, as we get into January, we're going to be at a significant level of epidemic proportions, I would say.
So the ripple effects of this will go on, and we may see more individuals struggling with depression, because we know that there's a correlation between both mental health and addictions. Sometimes you can't separate the two. When someone becomes, there's economic impact, there's social impacts. When someone becomes depressed and their symptoms of depression worsen, then they may use alcohol or drugs.
And the cost for inpatient hospitalization stays or incarceration is way above what it costs to fund community mental health.
The longer this goes, the more it will cost the state of Illinois. If people do not get critical mental health and substance abuse care, they don't just go away. They wind up in the hospital emergency rooms, and they oftentimes wind up in our county jails.
Cutting the funding and cutting services isn't the solution to the problem. It will just push things down the road.